If you care about your sexual health, then this message is for you. I'm Dr. Emmanuel Bale, and today I want to walk you through 10 things you should never do to your penis. You see, men often overlook their sexual health until something goes wrong. Your penis gives you important clue about the rest of your body. So understanding these signals and knowing what habits to avoid can protect your long-term health, your confidence, and relationship. Let's dive straight into the information. Number one, never ignore your penis. You see, one of the biggest mistakes men make is assuming everything is fine as long as there is no pain. But the truth is, your penis often reflects the overall condition of your body. When a man begins to struggle with erections, it's not just a sexual issue. In many cases, it's actually an early sign of problems with blood flow. Research has shown that if you follow men who develop erectile difficulties, a noticeable number of them actually go on to have heart complications. And these connections make sense. An erection depends on healthy blood vessels, balanced hormones, and stable nervous system, and a calm mind. When your erections are strong and consistent, it means these systems are working together properly. But when the erection starts to weaken, the body might be trying to warn you that something deeper needs attention. So don't brush off changes in your erection quality. Treat them the same way you treat chest pain and unusual fatigue. Take them seriously and get evaluated. Number two, don't try homemade fixes or experimental methods. There is one thing I cannot emphasize enough, and that is stop experimenting on your penis at home. As a doctor, I've seen the consequences, and many of them are irreversible. No home remedy, no secret technique, no viral recipe that is going to safely increase the length or thickness. And certainly, nothing you pour, nothing you rub or wrap around your genitals will magically change the size. And one of the most common mistakes is jerking, using the strong hand pressure to repeatedly stretch the penis. It sounds harmless, but over time, this can cause microscopic injuries inside the tissue. These injuries build up and creating scar tissues and long-term weakness in blood flow. I've seen young men in their 20s develop erectile problems after doing this aggressively. Other dangerous trend is using objects as makeshift constriction rings. I've treated men who place metal nuts, plastic rings, or pieces of bottles around the base of their penis. These items tighten as the penis swells, trapping blood inside. Once stuck, they often require emergency removal, cutting tools, and in severe cases, surgery. All of this can be completely avoided by simply purchasing a safe medically designed device if you truly need one. Your penis is not a do-it-yourself project. If you are struggling with confidence, performance, or size concerns, speak to a medical professional instead of risking long-term harm. And number three, keep it clean properly, not aggressively. Good hygiene seems obvious, but many men, especially those with foreskin, don't clean properly. If you have a foreskin, it's important to gently pull it back and wash underneath. Sweat, bacteria, and natural oils can build up, creating irritation and inflammation or even infections. One common condition is balanitis, which causes redness, swelling, and discomfort. But cleaning doesn't mean scrubbing harshly. The skin on the penis is delicate. Using strong fragrances, harsh soaps, and vigorous rubbing can cause irritation, can cause dryness and small tears. All you really need is a mild soap, warm water, and gentle cleaning. Also, you should always be able to pull your foreskin back comfortably. If you can't, that's a sign something is not right. In rare cases, conditions under the foreskin can go unnoticed for years, including early signs of cancer. While penile cancer is extremely uncommon, the risk increases if hygiene is poor or if the problems are ignored. If your foreskin cannot retract, see a doctor. It can often be treated with simple measures before surgery becomes necessary. Keeping the area clean, dry, and comfortable goes a long way towards maintaining a healthy skin and preventing infections. Number four, don't ignore pain, sores, or any warning sign. Many men delay getting help when something looks or feels off with their penis. They hope it will go away on its own. But ignoring symptoms can be one of the biggest risks to your sexual health. If you notice pain, sore, swelling, or a rash, or changes in the color or shape, those are signs that something is not right. They indicate a sexually transmitted infection, an irritation, a bacterial infection, or even a urinary tract issues. And if you ever see blood in your urine, that's not something to wait on. It could be related to the bladder, it could be related to the kidney or prostate. While penile cancer is uncommon, it is aggressive when it occurs. I've seen men avoid seeking help because of embarrassment, because of fear or shame. They worry about judgment, but delaying can make the situation worse. The earlier something is caught, the simpler the treatment. Waiting too long can lead to more invasive procedure, can lead to permanent damages or even life-changing complications. And remember this, your doctor's job is not to judge you, it is to protect you. And if you ever feel uncomfortable with one health provider, find another one. Your health is too important to live untreated because of awkwardness. Then number five, always practice safe sex. Stay in control. Safe sex is not just about preventing infection or planned pregnancy. It's also about creating a relaxed, confident environment where you can fully enjoy intimacy. When you are not worrying about diseases or consequences, you can be present, you can be connected and uninhibited. That makes sex even far better for you and your partner. Trying different condom types can help you find one that makes you feel comfortable and natural. There are ultra thin version, texture version, snug or larger size. One size does not fit all, and experimenting can significantly improve sensation. But safety also means staying in control of your movement during sex. One of the most painful and frightening injury a man can experience is penile fracture. Even though there are no bones in the penis, the tissue can tear if the penis bends too sharply or fully erect. This often happens during fast and forceful thrusting, when the penis slip out and hit a hard surface such as the partner's pelvic bone. If this happens, most men hear and feel a sudden pop followed by an intense pain and swelling. This is a true medical emergency that requires immediate surgery. Without quick treatment, long-term problems like erectile dysfunction or curvature can develop. Staying in control helps to prevent this. Hold your partner hip, adjust the angle, and avoid overly forceful and uncontrolled movement. And don't underestimate the value of lubrication. Lubricants reduce friction, it enhances comfort and makes sex more enjoyable. They are especially helpful for couples experiencing dryness due to stress, medications, and hormonal changes or menopause. Using lubricant doesn't mean something is wrong. It means you understand how to create a comfortable and pleasurable experience for both partners. Then number six, avoid excessive heat around your testes. Your testicles are designed to stay slightly cooler than the rest of your body. That's why they hang outside the body rather than be tucked inside like ovaries. The temperature difference helps to produce healthy sperm and maintain balanced hormone levels. Exposing your testicles to constant and intense heat can affect fertility and potentially interfere with hormone productions. Some common heat sources you may not think includes long session in hot tubs, frequent use of steam rooms, placing a laptop directly on your lap, keeping your phone in your front pocket, tight underwears that trap heat. None of these will cause immediate damages, but repeated heat exposure can over time reduce the sperm count and alter testicular function. If you are actively trying to conceive, or if you simply want to protect your reproductive health, it's wise to limit time in hot environment. Avoid placing warm devices directly against your groin. Your body works hard to maintain the right temperature for your sperm production. Give it the best condition to do its job. Then number seven, be gentle with yourself, especially during masturbation. Your penis is sensitive. The way you treat it during masturbation can affect your sexual performance with a partner. Many men develop a habit known as the death grip, using an extremely tight, aggressive motion that is far more intense than anything a partner can naturally replicate. While this might feel stimulating in a moment, it can condition your body to need an unrealistic level of pressure to stay aroused or reach climax. Over time, you might notice that regular sex feels less pleasurable and maintaining an erection becomes harder during partner intimacy. This is not because something is wrong with you, it's simply because your body has adapted to a pattern that is difficult to match the real life. Think about how your body responds to touch during partner intimacy or try to mirror that during solo play. Use lubrication to create a smooth, comfortable, or pleasurable experience. Masturbation should not be rushed. Treat it as a healthy expression of sexuality rather than something you need to hide or finish quickly. When you approach it with patience and awareness, it becomes a normal, positive part of your sexual well being, not something that interferes with your performance later. Then, number 8, don't smoke and take your overall health seriously. In fact, smoking is one of the leading preventable causes of erectile dysfunction. It narrows your blood vessels, it reduces oxygen supply, and it affects the ability of the tissue in the penis to feel and maintain firmness. But it's not just about erection. Smoking is also a major risk factor for bladder cancer. Erectile function is a reflection of your overall health. Earlier, we discussed how men with erectile issues have a higher risk of heart problems within the following years. That's because erectile difficulties often show that the blood vessels throughout the body, especially in the heart, are not working as well as they should. So, taking care of your health is not glamorous or instant, but is the foundation of a strong, responsible, and dependable penis. A few key habits may make a huge difference. So, you need to eat balanced diet with whole food, and you need to exercise regularly, combining cardio for blood flow with strength training for hormones. Also, limit alcohol, especially heavy drinking. Manage your stress because chronic stress lowers sex drive and disrupt erections. If you are unsure where to begin, start small. Even a short daily walk, fewer cigarettes, or one nutritious meal a day can create the momentum. Your sexual health reward consistency, not perfection. Erection thrive where your body thrives. So protect your lifestyle and your sexual performance will follow.